Thank you all for coming today. My name is Nicholas Ramondi. I'm joined by my colleagues Joshua Fenton, Renee Gonzalez, and Sarah Lopaka. And today we're going to be discussing with you our evaluation plan for the overdose prevention programs in my state. Just for your information, the PDF that is attached will have a blow-up of the logic model, which will make it easier to read, and will also contain our references. I wanted to start by giving you a little bit of background information as to why my state felt it was necessary to begin these overdose prevention programs. Between 2009 and 2016, my state saw a dramatic increase in the rate of deaths from opioid overdoses. In 2009, there was 138 deaths, but by 2016, this number had increased to 336 deaths. This is a 143% increase in the number of opioid overdose deaths. During that same time period, there was also a shift in the type of drugs that people were overdosing from. In 2009, 78% of the deaths were caused by prescription drugs, whereas 5% of the deaths were caused by illicit fentanyl. By 2016, the number of overdoses from prescription drugs was now 36%. However, the overdoses from illicit fentanyl had increased to 58%. Because of these dramatic increases, my state implemented a number of programs, which I'm going to let my colleague Sarah Lopaka tell you a little bit more about.
Thank you for the transition, Nick. Hi, everyone. I'm Sarah Lopaka, and I will be discussing some of the My State opioid programs and policies. So the first one I'll be talking about is the Good Samaritan Law. And this was designed to protect any person who was experiencing an overdose or who wanted to report an overdose. It would protect them from any criminal charges. And it would also protect them from any drug charges as well. So the purpose of this policy is to encourage any individual who is witnessing an overdose, maybe experiencing an overdose, to please call and accept medical care to help save a life. Because if you're in fear of being charged for drug charges or criminal charges, you're not going to be apt to seek out help. So the Good Samaritan Law is in place to make sure every individual feels comfortable making that call to receive help. The next program that I'll be discussing is the Prescription Drug Monitoring Program, which is more familiarly called the PDMP program. And so the purpose of this program is to provide health authorities the ability to input, how many opioids they prescribe, at what dose they prescribe them. This would all go into a computerized database that every healthcare provider could see and is on the same network about. And this would limit, initial opioid prescriptions to adults with no more than 30 milligrams of morphine equivalents per day and no more than 20 doses. Prescribers will also be able to review the PDMP every 3 months thereafter for continuous treatment. So this will help out, with those addicted patients that may hop from doctor to doctor. This will all be kept in one database that can be analyzed, and to see the data, it might be useful to see different clusters of where, the drug abuse is really happening. Another policy that we'll be evaluating is the Narcan delivery system. So the availability and the training to first responders. So this policy was put in place so that Narcan could be distributed to as many first responders as possible. And for anybody who's not familiar with Narcan, it reverses the respiratory depressing effects of opioids that ultimately lead to overdose. So the thought process is the more people aware of Narcan and the more people trained and the more people that are carrying it, the less overdoses will occur. That's the goal. I'm going to turn it over to Josh now. Thank you.
Thank you, Sarah. And now I will be discussing the stakeholders that come with our plan. We have several members of our research team. These members include first responders, government, healthcare providers, and the Department of Health. First off, to go into a little bit of detail out of all of these, we will start with the first responders. The first responders consist of ambulances, police officers, and firefighters. Moving on to the second item on our list, the government. The government consists of legislature and the governor. Thirdly, we have healthcare providers. These healthcare providers consist of physicians, pharmacists, and veterinarians. Lastly, we have the Department of Health. The Department of Health consists of PDMD and statistics. That rounds out the four major people or groups of people we will be working with in our evaluation. Now, Nick will discuss the evaluation model. Nick, take it away.
Thank you, Josh. Let me now discuss with you our proposed evaluation design. A while ago, Sarah was talking with you about the overdose prevention programs that were implemented by my state. We thought for practicality of this evaluation that the Good Samaritan law, while important, would be difficult to evaluate, and we felt that our resources could be better utilized examining naloxone training and availability for first responders, as well as participation in my state's prescription drug monitoring program by healthcare providers. As you can see here from our logic model, the 5 main questions that we intend to answer are: how many first responders are trained to use naloxone? How many first responders are carrying naloxone? The number of deaths that are prevented by naloxone administration, and the number of physicians participating in the drug monitoring program. We intend the study to be a time series analysis whereby we track how the participation in these programs has changed since their implementation in 2016. We will then track these numbers yearly with a goal of seeing an annual increase of 10% participation yearly until we have reached 100% participation. To gather the information, we plan to interview the head of each first responder department in the state. We are going to ask them what percentage of their first responders have been trained to use naloxone, what percentage of your first responders are carrying naloxone, and how many doses of naloxone has your agency administered in the last year. From the State Board of Health, we will be able to get data as to what percentage of healthcare providers in the state are participating in the prescription drug monitoring program. Also, we will be able to see how many deaths are still resulting from opioid overdoses. Let me turn you over to Renee, who's going to discuss with you our evidence gathering on this evaluation.
Thank you. My name is Renee Gonzalez, and I will be discussing how we plan to gather credible evidence. Quantitative secondary data will be provided by the PDMP's data warehouse. Data prior to the implementation of the mandated use of PDMP in my state will be compared to data after the mandatory use of PDMP by providers. Survey interviews will also be used amongst healthcare professionals to help us determine how knowledgeable they are in the importance of PDMP and how many providers are using it regularly. Survey interviews will also be used to interview all first responders in my state to determine the number of first responder agencies who have access to naloxone and the number of times naloxone has been given. The evaluation team will also determine if there has been an increase or decrease in the number of opioid overdose related deaths since the implementation of my state's opioid overdose prevention programs. The qualitative data from stakeholders is important to the evaluation because we want to encourage the engagement of our stakeholders regardless of the communities they live in and regardless of their culture and regardless of their title. We suspect that creating an atmosphere of open and honest communication between stakeholders and evaluation team members may not be feasible. So we hope that including translators and having them engage from the beginning to the end of the evaluation will help encourage participation. Thank you.
I'll be discussing the data analysis now of the MyState opioid programs. So we plan, what are the measurable or observable elements that serve as markers for your performance, program's performance. Number one, we hope to measure the percentage of prescribers who are currently utilizing the prescription drug monitoring program, or the PDMP, since the MyState opioid implementation. We also plan to measure the percentage of Narcan distributed to first responders before the MyState opioid implementation occurred versus the last 18 months. What constitutes success? Success at this time, we're unaware of how many first responders were carrying Narcan prior to the MyState implementation, but our team will define success as a 10% increase of all first responders carrying the Narcan. Our team is also unaware of how many healthcare providers previously were using the PDMP program, so we'll value success as 10% of all healthcare providers are utilizing the PDMP program. Indicators of success, like I just said, with the percentage of Narcan, the evaluation, the percentage of first responders with Narcan, the evaluation team plans on interviewing all the first responder agencies in the state and identify those who have access to Narcan and who are also knowledgeable about using it. And we also plan to track how many doses were given. We also would like to evaluate the percentage of healthcare providers that are using the PDMP program, like I previously stated, and looking into that and seeing, if there is an increase in healthcare providers utilizing this program. We'd also like to identify the percentage of opioid deaths that occurred after the MyState implementation, and look into the difference, whether we're hoping that it's a decrease since the MyState implementation versus before. We plan to use the inferential statistics, which allows the team to make predictions or inferences of the data. And that's going to help us really see, where we stand and how successful we are.
Hi, my name is Joshua Fenton, and I am part of the evaluation of the opioid overdose prevention program. My team and I have all decided to split up our responsibilities for this and speak about what we each individually have worked on. I personally worked on both the use and the communication of this evaluation. I will start off with going over the usage, and then I will continue on with the communication. The first objective pertaining to the use of this is the evaluation findings of this program will be used to educate several different parties. These parties include MyState legislators, Department of Health employees, physicians, veterinarians, and several others. The next objective I have on my list is the timeline for reportings and findings and potential recommendations aligned with key events by discussing potential findings in partner meetings before the evaluation, as well as discussing findings after the evaluation. Moving on to the third objective of the use on my list is speaking from a team perspective. We will be responsible for creating and monitoring an action plan to guide the implementation of the evaluation recommendations. In addition to that, the only follow-up that will be needed is from the parties we are educating. More specifically, we will take their thoughts on the recommendation into very, very strict consideration. The fourth and final objective I have on my list for usage is the lessons that should be learned and shared pertain to the changes that were made to overdose evaluation plans. This will be documented by comparing the effectiveness of overdose prevention programs before and after. That rounds out the use of our evaluation. Next, we'll move on to the objectives for communication. The first objective for communication is the evaluation stakeholders that will be involved in constant communication are my state legislators, Department of Health representatives, physicians, and veterinarians. The purpose of these parties being involved pertains to updating the status of the evaluation, partaking in meetings, and sharing the final results of the evaluation. Next, we will talk about the methods of communication we'll be using. These methods pertain to Skype meetings, emails, and written reports. In addition to that, there will be an in-person meeting at the very beginning and the very end, both more to lay everything out and to follow up. Thirdly, I will speak about how this will be best delivered. The best suited delivery for this information would be through the program manager and the evaluator. Lastly, the final objective on my list pertains to what methods are appropriate. We believe that the most appropriate methods for this specific evaluation of the stakeholder audience pertained to come from the stakeholder audience of interest. This is because we believe they will deliver the utmost improvement in the overdose prevention programs. That is all the objectives I have on my list pertaining to the usage and the communication of this evaluation. If there are any questions at all, please feel free to let me or any of my other teammates know, and we would love to answer them. Thank you, and have a good day.
Thank you. Now I will be discussing evaluation management. My state's Injury Prevention Center will manage and implement this evaluation. The Department of Health will review and provide feedback on the evaluation, serving as our external reviewer. Data will be collected through skilled survey interviews and collection of numerical data provided by the PDMP's data warehouse as well as the CDC. We hope to have data collected within a 2-year span, since we're encouraging 100% participation. Data will be analyzed through comparative analysis, since we will be comparing data prior to and after the implementation of my state's overdose prevention tactics. We hope to determine if these programs has any influence on the number of deaths due to opioid overdose. So whether it's increased since the implementation of these programs or decreased since the implementation of these programs. Thank you.
I want to thank you all for coming today. If you have any questions for us, please feel free to leave those in the message board, and we will be happy to answer those to the best of our ability. Thank you. Goodbye.